Hello, dental peeps out in 417 land. I bet you didn't think you would be seeing my smiling face so soon again. I am Dr. Howard Shane of Fox Grape Family Dentistry, better known as Dr. H around the office, so as not to be confused with the other Dr. Shane at Fox Grape, my wife, Dr. M.L. Shane. As offices are beginning to reopen this week, including our office, I have had a ton of questions from dentists, hygienists, and assistants regarding what we can and cannot do. Because of that, the Greater Springfield Dental Society and our president, Dr. Ashley Meyer, thought it might be a good idea to put out another video to help clarify some of that confusion. Some of that was made by a statement that I made in my previous video in an attempt to become a YouTube star. The number one concern or question involves the most recent CDC guidelines that were released on April 27th. The title of that guideline is Interim Infection Prevention and Control Guidance for Dental Settings During the COVID-19 Response. In that document is a section titled Postpone Elective Procedures, Surgeries, and Non-Urgent Dental Visits. To make it even more confusing, OSHA, in their most recent set of guidelines issued on May 1st, state that they support the guidelines issued by the CDC. So we have two entities that are still, to date, have not updated the guidelines concerning doing only emergency care in your office and not elective care. These two statements have caused a great deal of concern in relation to reopening our offices and what we are and are not allowed to perform. To be able to give you some good, solid answers and to put this question to rest, I contacted the MDA. Vicki Wilbers, the MDA Executive Director, was able to give me a very clear and concise understanding of where we stand. And it is that clarification that I am going to share with you today in this video. The MDA has been in contact with the Missouri Dental Board, who we all answer to under our license. And they have said, and this is quote, "There is nothing in Missouri rules or statutes that mandate that licensees adhere to the CDC's interim guidelines. The board does not have the ability to enforce these guidelines without statutory authority to do so. The board encourages licensees to be aware of all recommendations and guidance from OSHA, the CDC, the ADA, and DHSS, and any state or local health agencies, and to use their best professional judgment when making decisions that impact the health and safety of their patients, their staff, and themselves." This is in contrast to the board's ability to mandate what we follow under OSHA guidelines, which is Statute 191694. This is what we go over and cover in our annual OSHA training, and it involves bloodborne pathogen standards and universal precautions. And these are not recommendations by the Missouri Dental Board. These are a mandate because there is actually a statute. However, COVID-19 guidelines are just that. They are guidelines. So as we begin to open our offices and consider doing elective treatment, you should always remember your ethical oath to do no harm and to practice as safely and responsibly as possible in this current environment to ensure the well-being of those who engage within your practice, your team, your patients, and the community at large. They also suggest that you refer to the ADA Return to Work Interim Guidance Toolkit and the CDC guidelines for direction and guidance, but not as rules and regulations. So you all remember the time that before universal precautions, the incidence of hepatitis B was higher among healthcare providers than the general public. After universal precautions were implemented, the incidence of hepatitis B for healthcare providers was lower than it was in the general public. So we know universal precautions work. These precautions were established for blood-borne pathogens, Now we have to implement a whole new set of universal precautions for airborne pathogens. I like to call them universal precautions on steroids. Another burning question that I have heard time and time again is, can hygienists use ultrasonic instrumentation? The answer is yes, they can, as long as proper PPE and engineering controls are being used. You have to use the professional judgment of the dentist and of the hygienist to be sure that both are comfortable in whatever procedures you are performing. Remember, we are all in the same boat, so we all need to be rowing in the same direction for the good of our profession. I hope this video has been helpful, and I would like to offer you the opportunity to reach out to me if you still have questions, as well as the ability to share this video with colleagues if they have questions. Be smart and stay safe as you reopen your offices to routine care. Thank you.